Good afternoon, everyone. Welcome to the Multi-Ministerial Task Force press conference. On our panel today, we have Minister for Health, Mr. Gan Kim Yong, Minister for Education, Mr. Lawrence Wong, Director for Medical Services, Professor Kenneth Mak. Here are some ground rules before the press conference begins. Contents of the press conference are strictly embargoed until after the end of the conference. I will be announcing the exact time later for the embargo to be lifted. Please do not take screenshots or record this session. We will disseminate press materials, video footage, and photographs to you separately. If you wish to ask a question later, please use the raise hand function on Zoom. May I now invite the ministers to begin with a few words. Ministers, please.
Thank you. Good afternoon. In recent weeks, the number of new cases in the community has remained low. Among our linked community cases, about half were close contacts of confirmed cases and had already been quarantined. The rest were detected through our proactive screening or picked up from our enhanced testing of individuals with acute respiratory infection or ARI symptoms. The number of unlinked cases in the community is of greater concern, and it has also remained low. On the dormitories front, we are at the final stages of clearing the dormitories and testing the workers who have been isolated. The case count will likely remain quite volatile in the coming days before tapering down thereafter as we complete the clearance exercise. Elsewhere in the world, the pandemic continues to accelerate in many countries and regions. Some which managed to control an initial wave are now facing a resurgence of cases. In Asia, there have been worrying uptick in some areas, including Hong Kong, India, Japan, and Vietnam. Many Singaporeans are understandably concerned about imported cases. Indeed, we are keeping a very close watch. But keeping our borders sealed is not a sustainable strategy, as many countries have also come to realize. We have therefore taken a cautious approach to facilitate the return of Singaporeans, permanent residents, and work pass holders who are employed in Singapore, as well as long-term pass holders. To mitigate the risk of importation of cases, we impose stay-home notices on travellers upon their arrival in Singapore and test them before the end of their SHN. All of our recent imported cases so far have been isolated or placed on SHN. The risk of transmission to the community, therefore, continues to be very low. But we will continue to monitor the imported cases very closely, as well as the global situation, and adjust and update our border measures accordingly. As we gradually allow essential travel through the various schemes, we have reviewed our charging policy for COVID-19 treatment for travellers. Currently, the government bears the cost of inpatient medical bills for Singaporeans, PRs, and long-term pass holders who require treatment for COVID-19 at our public healthcare institutions, except those who breach our travel advisories. From 7 August, all outbound Singaporeans, PRs, and long-term pass holders who travel abroad under the permitted travel arrangement, such as that under the bilateral arrangements with Malaysia and China, will be able to tap on the regular healthcare financing arrangements for their inpatient medical bills should they have onset of symptoms within 14 days of their return to Singapore and require hospital admission for suspected COVID-19 infection. This means that Singaporeans and PRs will be eligible for government subsidies and MediShield Life Integrated Shield Plan coverage, and long-term pass holders may tap on their prevailing financing arrangements, such as the foreign worker insurance, but any remaining co-payment will continue to be paid by the patient. Those who are not under the permitted travel arrangements and instead travel in breach of the travel advisories will continue to pay for their COVID-19 inpatient medical bills in full. In addition, short-term pass holders entering Singapore under the permitted travel arrangements will remain responsible for their medical bills should they test positive for COVID-19 within 14 days of arrival in Singapore. While our community numbers have remained low, we must continue to be vigilant. Many Singaporeans are anxious to resume some of the activities, but we must balance that with the risk of transmission. Learning from the experience of many countries that have seen a second wave or some even third wave after restrictions are lifted, the multi-ministry task force has adopted a cautious approach towards easing of restrictions. At the same time, we have heard from many Singaporeans about the activities that you hope to resume, and we understand why some of these activities are important. And that is why we recently eased restrictions on two significant life events, weddings and wake and funerals. We recognize that these are key milestones in life that Singaporeans hope to commemorate, and that memories of these events will stay precious long after COVID-19 pandemic is over. We will continue to assess the situation and allow the gradual resumption of other events, including wedding receptions and some religious rites. But on the whole, most other events should continue to remain virtual for now. These include large gatherings and festivities surrounding national and community occasions. This does not mean that we can no longer celebrate these occasions, but that we will need to find new ways to do so. Take this year's National Day celebration, for example. Singaporeans are a resourceful people, and many have found new and creative ways to commemorate our nation's independence while adhering to the safe management measures. With the right mindset and attitude, we can adapt and make the best of the situation, even if we need to continue with safe distancing measures. On this note, let me wish all Singaporeans a happy National Day and a healthy National Day as we commemorate our 55th year of independence this weekend. Thank you very much. And I'll ask my Director of Medical Services, Professor Kenneth Mark, to give a quick update on today's medical situation.
Thank you very much, Minister. As of the 6th of August 2020, the Ministry of Health has preliminarily confirmed an additional 301 cases of COVID-19 infection in Singapore, and the vast majority continue to be work permit holders residing in foreign worker dormitories. And based on our investigation so far, there are 4 cases in the community, of which 3 are Singaporeans or permanent residents. 1 is a work pass holder. In addition, there are 4 imported cases, all of whom were tested while being on a stay-home notice after their arrival in Singapore. From these 4 imported cases, there is no risk of spread to the community. We continue to aggressively test that final batch of dormitory residents, and as Minister has alluded to before, we continue to be on track to clear all the dormitories in time, less a few standalone blocks in dormitories that serve as quarantine facilities. Because the prevalence of COVID-19 infection in these dormitories varies, and we are testing various dorms over the next few days, the numbers that arise and will be reported in our press releases every day will vary from day to day. This volatility will continue for the next few days before it tapers down as we complete our dorm testing as part of the dorm clearance strategy. Overall, the number of new cases in the community has continued to decrease, as Minister has alluded to, from an average of 4 cases per day in the week before to an average of 2 per day in the past week. The number of unlinked cases in the community continues to decrease from an average of 2 cases per day in the week before to an average of 1 per day in the past week. We continue to monitor these numbers, but these numbers can only stay down with the cooperation of all of us in the community. And as we come into a stage where we are in a celebratory mood for the celebration of National Day, we ask all Singaporeans to maintain their discipline, wearing their masks, continuing with their safe distancing measures, and to do their bit to keep Singapore safe during this time when COVID-19 continues to be a concern. We are still working through the details of the cases that we've just reported today, and further updates will be shared via the MOH press release that will be issued later tonight.
Good evening. We had earlier shared that the task force was aiming to complete the clearance of workers in the dormitories by the first week of August. And I'm happy to report that the team has indeed been able to complete the testing of all workers in the dormitories and will do so by tomorrow, 7th of August. So what remains are the workers who are in isolation. Right? They have been cleared from the dormitories, but they are remaining in isolation in quarantine facilities. This final batch of workers who are in isolation will stay in isolation, complete their isolation period, and will be tested before they exit from their quarantine facilities. And that's why, as you've heard from the Director of Medical Services, you will still see volatile case numbers over the coming days, perhaps over the next 2 weeks, because as these workers complete their isolation and we subject them to a test, we don't know how many will be testing positive or negative, right? It may be that very high numbers test negative and then we will have very few case counts. But it may also be that quite a large number test positive, and then on occasion you may see spikes in the cases. But we expect that to continue only for the next 2 weeks because we are dealing with the final batch of workers who are in isolation. Thereafter, we do expect the number of cases to taper down significantly because we would have cleared all the workers by then. The other issue that we are dealing with is to try and expedite the process for these cleared or recovered workers to get back to work as soon as possible. And we've shared before that we are working with all the contractors and employers, engaging them very closely to start preparing now. Do not wait for the workers to be cleared. Start preparing now so that they can meet all the safe distancing, safe management measures and can resume work as soon as possible. So that work is in process. We are continuing this engagement efforts with all the employers, especially for the construction contractors, and we are confident with these expedited processes that the vast majority of workers who are cleared or recovered will be able to resume work by the end of this month. So we are not only clearing the workers in the dormitories and making sure that they are safe, but we want them to get back to work as soon as possible, and we do expect the vast majority to be able to do so by the end of this month, which means that many construction activities and many construction projects should be able to resume soon. Finally, I should add that just because we have COVID-cleared dormitories doesn't mean that we should assume these are permanently COVID-safe dormitories, because we all know that the virus can flare up again, and that's why we are putting in place safeguards, particularly to ensure that all the workers in the dormitories will still be taking routine and regular tests once every 14 days. So that process and that regime, on top of all the safe management practices that are in place, will continue. And we will ensure and do our very best to working with the employers and the contractors to make sure that construction activities, that all of these activities that are of a higher risk nature will be done in a safer manner going forward in order to minimize the chances of large clusters forming in this sector again. So we will do all we can to put in place these additional precautions. At the same time, for all of us in the community, we again must not be complacent. By about the second half of August, as I said, with the dorm cases tailing off, we should see the total number of cases in Singapore coming down. Not just the cases in the community, but the total number of new cases every day should come down significantly by end August. But that is not reason. That is not a reason for us to be complacent or to let our guard down. We have seen the experiences everywhere in the world where even if there is a very low level of underlying transmission, very low level, cryptic, silent transmission happening, and so long as there is a lapse in the community or people do not observe the safe management practices carefully, these low levels of infection can suddenly flare up into large clusters anywhere, anytime. So we all just need to be mindful of this risk which still remains, and we all have to do our part to be socially responsible and do everything we can to comply with the safe distancing measures that are in place. So we encourage everyone to stay vigilant. We know it's not easy because it has been a long fight. For the past 7 months, we have been dealing with this virus, but we are making good progress. We are able to keep our community infection rates low, and we can, if we maintain that attitude, that mindset and discipline, we can continue to reopen and resume more activities in a safe manner. And on that note, let me join my colleague Mr. Gan in wishing all Singaporeans a very happy National Day in advance. Thank you.
Thank you, Ministers. We will now begin the Q&A segment. Media agencies, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question, please. May we have the first question from Timothy from Straits Times. Please speak after you have been unmuted.
Thank you, Ministers, DMS. Now, as Minister Gan earlier mentioned, imported cases are a concern on many Singaporeans' minds. So I'd like to ask, why are returning Malaysian workers only given 7 days of stay-home notice, while we are not swabbing travellers upon their arrival into Singapore? It seems like these two policies are a little inconsistent with one another, given our understanding about the incubation period of the virus. Thank you.
Thank you. We adopt a risk management approach, taking into account the assessment of risk profile of the source where travellers coming from, in this case particularly Malaysia. We also take into account the mitigating measures that the other country, in this case Malaysia, has put in place. So we take a holistic assessment of the risk of travellers coming to Singapore, and on the basis of that risk, we will then determine what are the precautionary measures that we need to put in place. Specifically on the SHN period, I'll ask DMS to explain from a professional point of view.
Yes, as far as the stay-home notice is concerned, we have taken efforts originally to isolate people who come from other countries into Singapore for fixed duration of 14 days originally, on the basis that this was the incubation period, the maximum incubation period that a case of COVID-19 infection could have. And then on the balance, on that abundance of caution, that was the period that we had defined. We then adjusted our regime to include testing because of a concern that there would be asymptomatic but infected travellers coming into Singapore. And this would allow us not to miss those individuals who are asymptomatic but still remain both infected and infectious despite finishing up their SHN period. We have since done several reviews. We've noted, for example, that when it came to countries with visitors coming to Singapore, the majority of visitors who were symptomatic would in fact have their symptoms within 5 to 6 days of their entry into Singapore, while those who are asymptomatic obviously would continue to need to be tested in this period of time. And that allowed us then to think about considering a shortening of the duration of SHN for countries where the original prevalence in that country was low. Therefore, on the balance of risk that we assess, the risk then of missing a traveller coming in, despite a shortened SHN, then manifesting with symptoms becomes even quite low in that setting of these countries where the prevalence is in fact lower than in Singapore. So we think on the balance of risk, we think we may be able to offer a shortened period of isolation, notwithstanding the fact that we'll continue to test travellers who come out from their isolation period of SHN, and the 7 days for these selected travellers would not be unreasonable. However, in countries where the prevalence rate of COVID-19 remains high, we think on the balance of that risk, we will still keep to 14 days for that category of travellers from those countries. So it's on the balance of the risk assessment, the number of anticipated cases coming in, that we then decided for selected countries, we could then lower that SHN requirement to 7 days.
Thank you, Minister, DMS. Can we have the next question from Soon Kiat from Zaobao?
Good evening, ministers and DMS. My question is somewhat related to Timothy's. Just like to ask, because with the upcoming implementation of the PCA between Singapore and Malaysia, we notice that there appears to be a difference in the treatment to Malaysian citizens who are Singapore work pass holders and Malaysian citizens who hold Singapore PR status in terms of the number of days of SHN and the number of required PCR tests. We would like to find out the reason behind that, and also whether there's any possibility for the cost of a PCR test to be reduced further in the near future.
I'll take the final question first, and that's an issue concerning the cost of tests. This is something that we will be reviewing on a regular basis, not just for the cost of tests with regard to the Singapore-Malaysia agreement or arrangement, but also the cost of tests in other settings as well. At this point in time, the cost would vary depending on which lab does it. It roughly hovers around the $200 mark. But as tests become more available, as the labs find it, in fact, easier to offer the tests at a lower price point on the basis of optimizing the test protocols, as the cost of test kits comes down because of availability of these tests, I am confident that the current price point would not be a permanent one. It will be continually reviewed, and I look forward to an opportunity to announce in future that cost will also come down. And that would obviously benefit all visitors and travellers who require testing either as a pre-departure arrangement or an on-arrival arrangement. We did look at the arrangement between Singapore citizens, permanent residents, and other visitors. The part of the arrangements differences in part also relate to whether or not these workers would be able to have controlled itineraries, whether or not the responsibility for this controlled itineraries could be enforced by companies. And there are also other secondary arrangements, considerations that have led to some of the differences that are present. As we announce further details, some of these distinctions would be explained as well.
Thank you, DMS. Can we have the next question from Cheryl from CNA?
Hi, good evening. I just want to confirm that the Malaysians entering Singapore under the Green Lane agreements, if they test positive, they will be considered imported cases, and how are we going to mitigate the risks from this potential group? Thanks.
Yes, the Malaysians who come into Singapore and who develop an infection within 14 days, and we believe that this is in part as a result of travel, would be regarded as imported cases. We do have various mitigating arrangements, even in the setting of these Green Lane arrangements. The itinerary for these people coming in on these arrangements is strictly controlled. The companies, in fact, sponsor them on these Green Lane arrangements. They take on the responsibility to make sure that where they visit, where they go, there are fixed itineraries to allow to mitigate that risk of exposure and then of spread as well. When they come back into Singapore, there are testing regimes that allow us to pick up cases as they arise and then subsequently quickly isolate them. We think that while there is obviously a risk with every visitor coming into Singapore, even under a Green Lane arrangement of importation of COVID-19, we think that risk is mitigated and we will be monitoring the situation quite closely. We are working closely with our Malaysian counterparts who themselves are putting in various measures to control COVID-19 infection in their own country. So rather than looking at this as a unilateral arrangement in Singapore to manage COVID-19, we should also see this as an opportunity for both countries to come together, each of us managing and mitigating COVID-19 spread in our own countries. And as we open up our borders, we would then be working cooperatively to keep the COVID-19 rates low in both our countries.
I should explain that the starting point actually is when we decide on these measures, we have to look at the risk assessment in a holistic way. First, Malaysians' prevalence rate is significantly similar to Singapore and in some cases lower than Singapore's prevalence rate, and therefore the risk of infection is quite similar to fellow Singaporeans who are in Singapore. So therefore, many of these measures that we have imposed are additional precaution so as to mitigate the potential risk. Just as we have, even within Singapore, we have our safe distancing measures to continue to reduce the risk of local transmission. And similarly, as Malaysians come over, there are various measures put in place, like testing, SHN, and so on. These are additional measures that we want to put in place to further minimize the risk of transmission. But the starting point is that we have to assess the risk level even in the source country itself. For countries with a very high prevalence rate, we will not be able to enter into such arrangements, and we will have to have a lot more stringent requirements if there are nationals who are to come back. Even for Singaporeans or PRs or long-term pass holders who need to return to Singapore from these countries with high prevalence rates, we will have to have additional precaution in place to allow them to return safely. So at the end, it's a balance of risk and managing the risk profile of different source countries and different individuals and different profiles of visitors, and we will tailor our measures accordingly.
Thank you, DMS Minister. May we have the next question from Philip from Bloomberg, please?
Hi, ministers. I wanted to just quickly ask, just to clarify, Mr. Wong, your point from earlier that you said they have already indeed finished the testing. It's done as of now. Just wanted to clarify that real quick. And just regarding work from home arrangements for people like myself, is there any idea about when we might be able to return back to the offices, or what you're advising now? Thank you.
So on the completion of testing, what we mean is that all of the workers in the dormitories have been tested. But there are, after testing, a group of workers who still have to be isolated. And after the isolation, we still subject them to a further round of testing. So the clarification basically means we've completed the testing of all the workers in the dormitories, but one final group remains in isolation, in quarantine. And that group in quarantine, before they exit from quarantine, we will still test them one more time. And because we are testing them one final time, we may pick up cases from this group. And that's why we said that in the next 2 weeks or so, numbers may be volatile because depending on what we see from the final test results, you may see a sudden spike, we may see nothing, we don't know. It really depends. And so aside from that, the rest of the workers have been, we've cleared the dorms, we've cleared the workers, and over the next few weeks, for the majority of the workers, including the ones even on, still serving their last final stretch of quarantine, we think that certainly around 90% of workers in the dormitories would be able to get back to work by the end of this month. Right? That's what we expect to be able to achieve, working together with the employers and contractors. On the question of, what was the other question? Work from home. We would like to encourage employers certainly to continue with work from home as the default arrangement. The current rules are quite basically, to require that employers can only have their employees come back to the office if there is a demonstrable need to do so, particularly requiring specialized equipment. We indeed have heard appeals from both employers and as well as from individuals. Some employers say that they would like more flexibility, and some individuals too say that while working from home is good, in fact, they are more productive if they are able to get back at the workplace, even if there is no need for specialized equipment. And for a whole range of reasons, sometimes they say that the home environment is not so conducive, and perhaps in the workplace with when you are together with your colleagues, you can be more productive as well. So we've received these appeals. We are still studying the matter and to see if there may be some change or some modification to the work from home requirement. That's something that we are reviewing. But I should say that even if we were to allow some modification or adjustments, we would still like to see, as far as possible, a high degree of people working from home, because I think that helps to, on many fronts, right? It helps to reduce congestion at the public transport. It helps to reduce the number of people coming together at the work environment, which can be a source of risk. So we still think that having a high level of commuting and working from home is desirable for quite some time. But having heard the feedback, we are in the process of reviewing these rules.
To add to Minister Wong's reply to Philip's question, the first question as well, at this time we are continuing to finish up our testing for the workers in the main dormitories, and we are still on track to be able to complete that by the end of tomorrow. But the results from those tests may take a few days before they come out, and therefore the subsequent reports we have for the next few days after the 7th of August may still reflect that testing that took place for workers in the dormitories. We will continue also to be testing workers that finish their period of isolation and quarantine in those quarantine facilities, and that testing is necessary to assure us that they are safe to return into the general community of workers in the main dormitories. So that period of testing may continue well after the 7th of August, and when we refer to the possibility of high numbers still being reported, it's on the basis of testing those remaining workers in those quarantine facilities. But we remain committed to finishing up our testing of the workers in the main dormitories. We believe that we will be able to complete that by the end of tomorrow, and that would be based on the plans we have. We are on track in this regard.
Just to add on, hopefully not add on to the confusion, and just to add on to clarify, I think even today, there are workers who are already in the quarantine facilities because they were close contacts of confirmed cases previously. So they will not be finishing their quarantine by tomorrow. This is an ongoing process. And if you would appreciate that these are the workers that have been in contact with confirmed cases, and therefore they are, in a way, higher risk of exposure and higher risk of being tested positive. And as we test them when they finish their quarantine period, we are likely to pick up more cases, because these are basically workers who have been exposed to positive cases. As to how many, it's very difficult to predict, because it depends on the extent of exposure, and depends on whether they are positive or not. And in some days it may go up, because we just happen that this batch of workers who are finishing their quarantine period happen to have a high prevalence rate. And some days may be very low, because these workers are generally uninfected. So you may see volatility in the numbers, so it's not a steady state number. So just bear in mind that most of this number will come from the quarantine facilities. And we will try to explain as we report these numbers, so as to give the context of how these numbers arise.
Thank you, Ministers, DMS. May we have the next question now from Evgeny from Itatas.
Thank you. Good evening. Now many countries are on alert of the second wave of COVID because of upcoming autumn and winter, which will be seasons of flu. I would like to ask, is there any research has been conducted in Singapore about how the spread of COVID can be dependent on the seasons? Thank you.
I asked DMS to talk about the scientific aspect, but Singapore, as you know, don't really have a season. I think COVID-19, as we have seen over the last 6 months, has been here and continue to be here. I don't think the season has a lot of effect on Singapore. In other countries, perhaps, maybe DMS can elaborate further.
Yes. In the early days of this outbreak, you may remember in January, February, there were experts who were predicting that COVID-19 could die off by this period of time, because it was coming into the warmer months of the year. That was a theory that had quite a bit of attraction for some. There was some work that people had done on the basis of previous other viral infections, but we haven't seen this bearing out. As you know, we've got large outbreaks occurring in different countries, both in the northern and southern hemispheres. So you have different extremes of the seasons in both the northern and southern hemispheres, and we do have large outbreaks occurring in both hemispheres. So I think at this point in time, most of us in the public health community, in the infectious disease community, are not too fixated about whether or not the seasons have an impact on the prevalence, the spread of COVID-19. We continue to emphasize the need to disrupt potential chains of transmission based on our understanding of how COVID-19 spreads. Early detection is important. Getting the community in any country, in any society to cooperate in making sure that they reduce that risk of transmission is important. And we'll continue to work at this. If certainly the seasons play a role, and if it turns out that in fact this is something that leads to a lower incidence of COVID-19 in the future, would be happy with that. But I think at this point in time, the evidence does not support a very strong seasonal effect on COVID-19.
But I should add that for Singapore, I think it's better for us to focus on safe distancing measures. We can't bank on the weather to help us. And if you look back during our circuit breaker period, the number of cases went down to very low levels, almost zero. And as we open up and we see a number of cases picking up, and fortunately we are still keeping it at a low number. And this is, to a large extent, we must thank Singaporeans for cooperating with us, helping us, doing their part in maintaining the safe distancing measures. And as we move further into phase 2, some of the measures are being relaxed, including some of the events that we mentioned earlier. And we hope Singaporeans will continue to exercise common sense, to exercise safe distancing measures as they deem fit. I think this will help. And we talk about back to work. We talk about work from home. We are reviewing, but it is still important for us to bear in mind that we should, in any case, reduce, minimize the number of contacts we have every day, and minimize the duration of the contacts we have with people every day. This will help us to reduce the risk of transmission overall. I think that's the most important part about safe distancing measures.
Thank you, Minister. DMS. Can we have Pei Ting from Today to ask a question?
Yes, hi Ministers. So my question is about the number of recent suicide and attempted suicide incidents involving workers living in dormitories, right? So my questions are what is the MTF's assessment of the anxiety and unhappiness of workers, especially those in the more badly affected dorms, and how had their welfare been looked after mentally, and also whether is mental health increasingly an area that the MTF is looking into by formulating a more comprehensive plan to address these budding issues. Thank you.
Thank you very much for the question. We're indeed concerned about the fact that our migrant workers have been accommodated in facilities under very tight regimes. They've not been allowed to come out of the dormitories into the community freely. And that prolonged period of isolation will obviously have potential adverse effects on any individual, not just migrant workers, but anyone who in fact has to be cooped up in isolation with very limited opportunities for social interaction. So this is a concern for us. The interagency task force working with MOM and various private stakeholders, partners, have in fact been looking at how to support the welfare of these migrant workers in a variety of different ways. They've taken pains to help the migrant workers to celebrate holidays, to make their stay within the lockdown dormitories as meaningful as is possible, albeit within the lockdown regime that they are in. They've also offered help through a variety of ways with an opportunity for them to call in hotlines for help. There are staff that come down and encourage workers to step forward if necessary for counselling. So mental health has been a concern for that particular task force for quite a while, ever since they started work in the dormitories. We continue to work on this piece. They have the task force has a work group looking very specifically at mental health issues, and they have involved various partners across many domains, including counsellors, social workers, psychiatrists, psychologists, to see how to better improve the support that can be provided to migrant workers in this regard. We are aware also of incidents of self-harm or attempted self-harm through suicide in some of the individuals in the dormitories. This is a cause of concern, and the task force continues to look at it to see how to reach out to support migrant workers who have needs that have to be addressed in this regard, and they're looking at ways to reach out and support them further. This continues to be a work in progress, so I do not pretend that that work is completed, that we have a very comprehensive system of support. But the task force is committed to making sure that the mental health needs of the migrant workers are looked into, supported, not just now, but there's a sustainable framework that would continue in the dormitories even after the outbreak comes under control within the dormitories.
Thank you, DMS. Can we have the next question from Yu Feng from TNP, please?
Hi, thank you, ministers. And DMS. I think DMS's comments just segues nicely into my question, which is, I wanted to find out what is the new normal for the dorms after they've been cleared. So I'm wondering if there's another outbreak of infections in a particular dorm, what happens? How long will the fast teams be stationed there in the long term? I mean, why do you see that happening? Yeah. Thank you.
So as we highlighted just now, the work site, the housing arrangements are likely to be different. We want there is a process of housing the workers differently, so that instead of having workers from one employer dispersed across different blocks, we're trying to consolidate them together for better management. That's one. Secondly, we are looking at now a whole range of safe management practices within the dorms and in the work sites, in the transportation, so that all of this can be done safely. And then thirdly, we have routine testing of the workers once every 14 days. If through routine testing we pick up one case, the intention is to go in very quickly, isolate the workers perhaps within the room or perhaps within the entire floor even, so that you can pull out the workers who are at risk without having to have all of the workers in the block or potentially even in the entire dormitory subject to a lockdown again, right? So the idea of a routine and regular testing is to be able to pick up early, together with other methods like detecting of wastewater. So we have a range of surveillance methods that allow us to do early detection. When we spot a case, we again do the contact tracing, potentially all the roommates within the room, everyone in the floor, perhaps if they have come into contact with one another, we pull them aside into quarantine, and then we do a sweep, test all the workers, and if they are safe, they can continue to work. Right? So that's the so-called protocols, the new protocols that we will put in place to reduce the risk of large clusters forming in the dormitories again. And with all these new measures, we hope we can preempt, we can identify early, and we can allow construction work in particular to resume safely without this risk of large clusters forming.
We're also discussing with MOM very closely on how to continue to support migrant workers, their health and their welfare, even after we bring the COVID-19 outbreak in the dormitories under control. Many of the best practices that we have put in place now are likely to continue. We continue to have discussions about how best to keep these innovations and measures in place in a sustainable way. So we innovated telemedicine for many of the dormitories.
This is likely to continue, as is telemonitoring using telekiosks and various vital signs monitoring devices that we had deployed into the dormitories. We will be looking towards establishing more long-term medical facilities dedicated towards supporting the health of migrant workers. These may include a combination of medical posts or medical centers either on site or close by to the dormitories to provide some of our regional support. They would be tasked not just to look after acute needs, for example, respiratory infections, but once they have a more long-term presence, they will be able to do much more than what we are doing now. And that may include looking after the long-term chronic disease needs for migrant workers and also their mental health support. So this would be some of the areas we're looking at jointly with the Ministry of Manpower, and we look towards creating a more sustainable structure to provide support to safeguard the health and welfare for these migrant workers even after the dormitory operations are complete.
So I think it's important to bear in mind that we ought not to look at individual measures in its own, from its own perspective, because it is all the measures putting together that will help to mitigate the risk of transmission. In particular, safe distancing is very crucial, plays a very crucial part. Even if we are able to keep the dorms clear, you have to bear in mind that we have to also make sure that the workplace is safe. Otherwise, they infect each other in the workplace and bring back to the dorm, then we have another outbreak again. It's quite similar to the household cases that we see from time to time, including the Tampines Street 11 case where we see many members in the household gets infected. That's because the nature of a household interaction within the same household. And it is not possible for us to tell the household members to say, please stay away from one another, because we don't know which household is infected in the beginning, and we can't stop every member from interacting with one another. So household cases are difficult to prevent. Once there's a case in the household, there's a risk to the rest of the household members. But what is important, therefore, is to prevent the case from happening in the household in the first place, and that is safe distancing in the community. Then if you are able to exercise safe distancing in the community, reduce the risk of infection in the community, then the risk of bringing back infection to the household will be significantly reduced. Then the household infection cases will, as a result, be reduced. So we have to look at the whole package of measures in its totality, and by working, all these measures working together, then we will be able to effectively reduce the risk of transmission. So sometimes we may need to allow some of the measures to be relaxed, to be rolled back, like working from home and so on. We will need to review to make sure that it continue to be sustainable and effective and productive. But even as we relax some of the rules, we need to continue to be tight on the other rules. In fact, in some areas, we may need to tighten further some of the rules so that overall the risk balance is maintained, so as to keep the risk of transmission as low as possible in the community, so as to reduce the number of infection and reduce the risk of clusters forming.
Thank you, Ministers, DMS. We have time now for the last 3 questions. Can John from Reuters ask your question, please?
Thank you, Ministers and DMS. I just wanted to follow up on the border issue and reopening borders. I'm just trying to get a sense of what the game plan for Singapore is here. I mean, would you hope that if cases drop as expected in the community and you clear the dormitories, that you would at one stage become virus-free? Or is that not feasible given your commitment to reopen the borders? Thank you.
I don't think that we are likely to be able to achieve a status of being completely virus-free, or even eradicating the virus completely. Even after the circuit breaker, after reducing activities to a very large degree, we continue to see new cases. right? And on a daily, you may have 0, 1, but there was still underlying transmission. Today, our community infection rate is very low, and we have a whole host of surveillance mechanisms in place now, because anyone who has a cough and cold, acute respiratory illness, you go to see a doctor, at first presentation, we already test the person. We are testing wastewater, we are putting in all these mechanisms in place, but we still think today that there is some underlying rate of infection. It's very, very low, but it is there. And it's quite likely that this was the case in many other countries where you saw a resurgence of cases. Many other places where you saw very low case counts on a daily basis for many, many days or even weeks, sometimes 0 for many days, and then suddenly a thing spikes up. And the reason why there is a resurgence is because that very low underlying infection rate reached a spot where safe management practices were not complied with. It might have been a lapse, it might have been somebody being careless, and that particular lapse or that particular incident ended up in being a super spreader person or a super spreader event. Then that one lapse not only impacts 1 or 2 people, it ends up with a large cluster. That's how we see resurgence happening elsewhere. So I think for us in Singapore, we are quite realistic that it may not be possible to get to a virus-free status. It may not be possible to eradicate the virus, but the key is to learn how to live with COVID-19. It will be with us for quite some time, and we have to adjust our way of life. We have to put in place new measures to manage through this period, recognizing that the virus is with us, but it doesn't mean that we stop living, or we all live in perpetual circuit breaker. It's not possible, right? So we have to resume our activities. We have to get on with life, but we do so in a different way. We find new ways of celebration, as was said just now for National Day. We find new ways of interacting with one another. And even if we have to resume travel, we do so in a way that's safe with all the necessary safety measures, be it testing or SHN. So that's how we see this phase, and we are likely to be in this phase for quite some time. And as long as we are able to put in place the necessary measures, as long as Singaporeans and residents of Singapore comply with the safe distancing measures, we think we can progressively resume more activities while keeping the infection under control. That's our objective.
I think several weeks ago, I explained that as we begin to embark on phase 2, we do expect number of cases to go up. I'm referring to the community cases to start to go up, because as you have more interaction, more encounters, more contacts, you're likely to have more transmission. So far, we have been able to keep the number low, but the risk remains there. The key objective really is not to totally eradicate the virus, because it's not possible until maybe you have a vaccine. So you will continue to see these cases, but the key really is to prevent these cases to become a cluster, and to prevent a cluster becoming a big cluster or multiple cluster. And the strategy is really to find effective ways to terminate the transmission, even after cases emerge. So therefore, over the last few weeks, you see sometimes we have a handful of cases, sometimes we have 10 cases in a community, but we need to move very quickly to slow down or to even truncate the transmission as fast as possible. So our ARI testing is very important. Now we go, as Minister Wong mentioned, we try to test them on the first day. They turn up in our doctors, and therefore we want to take this opportunity to also remind Singaporeans to please go and see a doctor when you are not well. It doesn't matter when you feel that, it's a small matter, I will just take 2 Panadol, maybe slip it off, I'll be all right. So please go and see a doctor, have it tested, so that we are able to arrest the transmission at the early stage. This will prevent from the one case to become many cases and to form a cluster and to eventually become many clusters. So if we are able to do that, then we will be able to keep the number of cases low in the community, and that will allow us to continue to see how we can ease the restrictions to allow more activities to resume, more interaction to happen, while continuing to exercise safe distancing. So I think the key is not really to aim for zero case, and that will be many months to come until vaccine is available. The key is to keep the numbers small and keep the transmission short. If there are cases that occur, try to stop it as early as possible and as quickly as possible.
Thank you, Ministers. Can we have the next question from Claudia from BT?
Hi, good evening. So my question is regarding the impact on the property sector. So, I mean, in May, the government announced for the property sector in areas such as project completion, and this was in response to the COVID-19 pandemic.
Sorry,
You
Claudia.
mentioned earlier that the task force is
Hi, Claudia.
confident
Sorry to
that-
interrupt, but could you start your question again? Because we lost part of your question earlier. Thank you.
Sure. So my question is regarding the impact on the property sector. So in May, the government announced a 6-month reprieve for the property sector, and this was in areas such as project completion, and it was introduced in response to the impact of COVID-19. And Minister Wong, just now you mentioned that the task force is confident that the majority of workers can resume work at the end of this month.
Hi,
And then it
sorry,
would take some
Claudia.
time.
Hi, sorry to interrupt. I have to ask you to repeat again, please. Just the last part was lost.
The last.
Okay. Yeah, so you mentioned that the majority of workers can resume work by the end of this month, but even then, it would still take some time for the resumption of work because of the new safety measures and also the supply chain disruptions. So would the government consider a longer than 6-month reprieve for the developers and also the contractors?
I will answer even though I'm no longer in MND. But basically, the earlier extension of the project completion period and the period for developers to sell their properties already was quite generous, taking into account the fact that we recognized even at that time that it would take some time for the construction sector to resume activities, and so we had allowed for some buffer at that stage. Obviously, we will have to continue to monitor the situation going forward. We do expect, as we said just now, most of the activities to resume quite soon. Majority of workers will be able to do so by the end of this month, and we do expect most projects to get going this month, and certainly by next month, almost all of the projects should be able to get going by then. But we will continue, the government agencies, BCA, MND will continue to monitor the progress and then continue to discuss with stakeholders in the built environment sector to see if this or any other measures might be necessary to help the industry progress along and overcome this particularly difficult period. So I'm sure the agencies are all very mindful that this is a very difficult period for contractors, for developers, and they will continue to engage them closely to see what we can do to work with the private sector and overcome this particular hump. Beyond this, I think once projects get going, once the activities get going, we will need to help the contractors get used to the new normal of what construction activities are like. There will be more measures in place, more protocols. There will be more testing of the workers. So it will be a completely different environment for the entire sector. So we are quite mindful that it really goes beyond just the resumption of activity. The entire sector has to transform itself, restructure, transform itself, be more productive. And this is I think it's a long journey that the government agencies are committed to working closely with the private sector to bring this about.
Thank you, Minister. We will now take the final question. Can we have the final question from Nicholas from Yahoo?
Hi, so I wanted to follow on Pei-Ting's question just now. So, given in light, especially in the sense that the dorms are going to be cleared by tomorrow, will the
You have to repeat.
Sorry, just give us a moment. Could you repeat your question, please, Nicholas?
Yeah. So I wanted to follow up on Pei-Ting's question with regard to the mental health of the workers and what is being done for them. So will the MTF consider loosening some of the restrictions on their movements, especially in light of the fact that the dorms will be cleared by tomorrow? For example, letting the healthy workers go out in batches for recreation or to socialize for a little bit. And at what point do you think the workers will be allowed to move about freely again?
Those are certainly things that we are very mindful of and we are monitoring very carefully. Even when the workers are within the dormitories now, it's not as though there is no provision for them to come down, have some, opportunity to go out of their rooms. We already provide for that, but they are still confined within the premises that they are in, the dormitories. The question of whether or not they will be allowed to go beyond that, I think that's something that we are considering very carefully. And then, when we talk about allowing them rest days, where do they go beyond the outside of the dormitories? That's also something that we are studying very carefully. We will have to, as I mentioned earlier, monitor the situation, because after clearing such a high viral load environment where the dormitory clusters are, after clearing through that, we often find that there are residual cases even continuing for weeks. Remember, this was the case for the workers, construction workers in the community, right? We had tested them, we had cleared them, but even as we subject them to regular testing, we still see quite a number of workers testing positive, despite them serving 28 days of isolation. 28 days, nearly 1 month. But after that, when we test them, we still pick up positive cases. So the reality is that there have been large clusters amongst migrant workers in the dormitories. We have cleared them. They are resuming work. But we need to monitor the situation. We need to put them through a routine and regular testing for a while more to be assured that we are indeed clearing and testing every worker and that they are indeed free from the virus. At some point, certainly, then we will also look at, how, as we have assurance that the testing process is done and the workers are free from the virus, we will also look at expanding, the provision for them to go out, be it to recreational centers or to the community at large on the rest days. So those are considerations that we do have in mind, and we will plan and stage that step by step to ensure that this is done in a safe manner for the workers themselves and also for the community at large.
Thank you, Ministers and DMS, for your time. And thank you, everyone, for joining us today.